It's no secret that people believe that movement is a very healthy thing, but why is it a healthy thing? And we're going to go into not just why it's a healthy thing, but we're going to go into all of the different aspects of health. Maybe not all of them, but a lot of the different aspects of health that it affects. We're going to go into how you start movement, and we're going to go into actually the why of how it helps you get healthier. So I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 5,000 patients. And through that, I've learned a lot. And one of the biggest things that chiropractic care does is instill movement in the joints. And this is an important thing because movement does so much more than just cardiovascular health, right? Like a lot of people look at it and they're like, well, I just need to get into cardiovascular shape, or I need to get, stronger muscles or different things like that. But movement is so much more than that. It allows us to interact with our environment, right? So ultimately, when humans developed, the big goal of movement was to allow us to help to find food. When we were sea creatures, the waves came past us, the water was constantly flowing by, and with that we had a constant supply of nutrition. We didn't have to go and search for it. However, as time took its course and we started to be more mobile, we needed to go and find food. So that's ultimately the reason for movement. And what that movement does is it helps us interact with our environment. It helps us, get cues to what's going on. That's why the vision is so important with movement. It's why, balance is so important with movement. All of these different things, our body and our brain has to communicate together to get all of that. But it doesn't just help us interact, right? It helps us to interact, socially. It helps us to, move and sleep. It helps us to do all of these other things. And when we're looking at chiropractic movement, when two joints get stuck together, so to speak, when we have a reduction in the range of motion, it's kind of like taking two suction cups and squeezing them together. And it's hard to pull those apart when you have them stuck together like that. What we're doing with that adjustment is we're breaking it loose. And it's not going to all break loose at the same time in most cases. What's going to happen is a small portion of that's going to break loose, right? You're going to have more range of motion. You're not going to have full range of motion, but you're going to have more range of motion. And if there is any lack of range of motion, it changes the metabolic capacity of that joint, because the way that joints get their nutrition in is they open up, and that creates a low pressure in there. It sucks the nutrition in, and then as they close down, it creates a high pressure inside the joint, pushes that junk out. So all those waste products get pushed out. So that open and close creates the nutrition in, nutrition out, nutrition in, waste out. And when we get that, the joint can stay healthy, right? The second that we lose that, we start to get inflammation. Why? If we don't have full range of motion, we can't get those toxic waste products out. They start to get they start to irritate those areas. That's inflammation, right? That inflammation over time becomes, it becomes degenerative. It starts to break things down. And then over more time, it actually shows the bigger changes that you would see on like x-rays and things like this, the arthritis or, erosion of the disc or whatever it may be. Wherever the setback is, whatever the problem is, it may be a little bit different in that. But what happens is, as you lose that motion, you lose the health of that joint. So restoring that motion is very, very important, right? Okay, so diving into the next segment, what all is movement affecting? It does affect your cardiovascular health. It does affect your strength, but it also plays a big role in sleep. The amount of movement that we have plays a big role in the deep sleep that we get, one of the more important kinds. When we get that deep sleep, that helps to improve our immune function. That immune function is very, very important, not just for our bodies, but also for the brain. When we get into that deep sleep, that's when the brain's, ultimately the brain's trash man comes in and cleans all the junk out. If we don't get into that deep sleep, we are not as efficient at that, and things build up over time. And things that may be associated with this, they're finding a correlation. They're not knowing if it's causative or if it's just correlation. Like Parkinson's, Alzheimer's, dementia, different things like that are all associated with this. Movement plays other roles though too. When we start to move around, we move our gut. We start to increase blood flow in different areas. So we start to get some of that nutrition in. We start to get our gut moving the way that it's supposed to. It helps to move food through. It helps to do all these things to make sure that everything is getting the nutrition that it needs and getting those waste products out. So it's kind of like the joint on a bigger scale. And it's kind of a cool system, but if we don't have enough of that movement, if we're not able to go through a range of motion because we're locked up, that's the correlation with, You know, people come in and they're constipated, they get adjusted, and then all of a sudden they're not constipated, or different things like that. That would be the correlation, is if our movement is holding us back from getting that movement that is necessary in there. So it's kind of a cool system that movement helps to get that blood flow in, that nutrition in. It helps to get the waste products out on a bigger scale as well. So you may be asking yourself, is chiropractic care right for you? Do you need more movement in your life? And the answer is, it depends. We've got to start on where we're at, right? So if you are in a precarious situation where you have a lot of pain, you have some disability, different things like that, you've got to be a little bit more careful. You know, if your balance is thrown off, you've got to be careful in how you do that. Now, there are different ways that we could start this. Chair yoga is a great way to start. You know, you're sitting there and you're moving through your range of motion from a chair, from a seated position. It's safer for people who are debilitated, people who have balance issues, different things like that. So there are ways to start very, very small and still get your movement. Now, if you are able to get up and move, what kind of exercise should you start with? Starting with, you know, just regular cardiovascular exercise, walking a couple blocks or different things like that can be a very, very great place to start. However, that's not the only thing I would do. For anybody out there, I would recommend some form of more intense exercise. And talk to your doctor before you do this, because intense exercise means a different thing for different people, right? We don't want somebody who's at risk for a heart attack to go out and, you know, run really, really hard for, you know, 5 straight minutes. That may be something that sets off or sets them up for that heart attack or stroke or bigger things. So talk to your doctor on this. Intense for you may be going for a brisk, you know, 2-block walk. We've got to figure out exactly what you need. It's going to be different for everybody. So is chiropractic care for you? That may be a conversation that you want to have. And that's a conversation I'm happy to dive into as deeply as possible. If you want to have a conversation with me, reach out either through Messenger, through the little chat button, or whatever we need to do. But chiropractic care can be a very, very valuable aspect to healthcare. And in most cases, it is a very, very good fit for people, and it helps to instill that motion that is going to help to decrease the inflammation. Now, is chiropractic and motion the only thing that's needed to decrease inflammation? No, this is where we also need better quality diet, hydration, we need sleep quality, we need stress management, because there's multiple different angles that inflammation will come at us from. And the more robust we can be in addressing those things, the more robust your results are going to be. So, as always, I love and appreciate you guys. I appreciate your attention. I know that's one of the most valuable resources, and I appreciate you spending some of that with me. And I'll catch you on next week's video.